So, India finds itself at an interesting point in its COVID 19 journey because now the total cases count is approaching 1,40,000, which means that it has bumped Iran from the top 10 list and made a space for itself there. The death tally has exceeded 4,000. At the same time, we are now in a lockdown 4 stage, and we are clearly and decisively moving towards opening up our society and economy. How do we balance this question of lives and livelihoods? Because how much longer can we keep the lockdown going? Because so many migrant laborers and other sections of society who are poor and vulnerable would also need concrete jobs and employment to get their livelihoods going. So I've got with me a cardiologist based out of Memphis, Tennessee, Dr. Indranil Basu Ray, to help give us a basis in science on how we should open up the economy and the path ahead. Welcome, Doctor.
Welcome. Thanks for having me.
Uh, Dr. Basure, as I was saying, now we are obviously moving towards easing up the lockdown. Of course, it would come up on states to decide how much we're going to open up. Is there a scientific basis? What is science telling us on how we should be looking to open up our economy?
You see, in any economy, it is you have to have a scientific opening. At the same time, you should have one of your feet on the ground realities. I mean, you can't have people dying out of hunger or economy completely devastated by keeping the country closed forever. So ultimately, you have to open and you have to use the best of local realities at the same time what science says. The good news is we have got many things we have come to know about COVID 19 now, which we did not know before. Like in the initial stages, as you know, based on a paper in New England Journal of Medicine, we thought that COVID could exist in a room as an aerosol for 2 hours, 2 to 3 hours. It could rest on surfaces like a doorknob for 2 to 3 days. So even if you went into a room where somebody with COVID came and went off, you possibly get COVID. If you touched a door handle, you'll get COVID. Now, it's still possible that every one of these can give COVID, but the CDC has made it clear that chances of this things like your food packet or the packet from Amazon dropped at your door giving you COVID, if at all, if it happens, is extremely small.
Right,
Like for
right.
like for 17 days, they found RNA on the Diamond Princess. So, because we did not know the disease, all these are very scary, extremely scary. But now CDC says that there is undoubtedly a chance of carrying, but most carriage is not being done by this. Most of the people are getting the infection when you do not maintain social distancing. If you come within 6 feet and you don't maintain social distancing, that is where the transmission is occurring. So that's a big difference from what we knew 2 to 3 months back.
Right. I mean, that's really critical because the fear has been of coronavirus spreading through surfaces. When we procure goods, our daily essentials, there's a fear that we might get infected by that. And you're saying now that the chance of that is significantly lesser.
Exactly. And CDC actually has on its website also clearly mentioning that coronavirus is, though theoretically it is present and practically it may be happening, but the basic truth is that coronaviruses don't live alive on these surfaces for long.
Right.
So the actual transmission is probably from people to people who are not maintaining social distancing.
Right. Right. Right.
That is one really big thing. The other very important thing that makes me strongly believe that India should start opening up, obviously with appropriate planning, given the socio-economical condition in India. As we saw, there are thousands of migrant laborers who are out of the job. There are still people below poverty line in India who have a food to mouth, hand to mouth existence. So we cannot keep the economy closed forever. Even America, say for example, we have 24 million jobless. So America is opening up and the number of deaths in America is increasing. So this has to be scientific. So what else in science is calling us to open up, and with following certain restriction. That is this. So COVID, just like other coronaviruses, has shown a peculiar tendency to spread in clusters. What does that mean? A lot of infections spread in clusters. But COVID, what it does is that it small number of people can actually spread to a big number. Now, what do I mean by that? So, while trying to model, they came to about a figure called the R. So, R means how many people can get infected from 1%. How many new people can get infected from 1%? The R value for COVID, if you do not maintain lockdown, is 3. But they found this number is not appropriate to describe the behavior of COVID 19. So they came out with another number called K, or the dispersion factor. So what does dispersion factor mean? Dispersion factor is a value where the smaller the number, it means is smaller number of people is causing greater infection.
Right.
So there have been different values for K by COVID, but in a latest paper published by the London School of Health and Tropical Medicine, says the value of K for COVID is as low as zero point 0.1. Now, what does that mean? Let me give you a perspective. For the SARS virus, which came in 2002 2003, it was 0.16. For the MERS virus, which came in 2012 to 2013-14, it was 0.25. So you can understand it looks like it is an extremely small number of people who's calling the wide level of infection. In fact, one of the authors from the London School of Tropical Medicine clearly says probably 10% of cases is responsible for 80% of the spread.
Right.
So this is a radically new important information.
Right.
CDC itself says that pre-symptomatic and asymptomatic people are less likely to spread infection. Not zero, but less likely.
Right.
Now, what does that mean? Based on present calculation, around 13% people who are pre-symptomatic. Now, what is pre-symptomatic? Pre-symptomatic means you get a virus, but virus has not infected you. I mean, there's virus in the environment. Every minute you have a billion different viruses. You may not have COVID. You have a billion different bacteria in your mouth, in your eyes, in your hand, in your skin. That doesn't mean you're infected. So these are pre-infective. And second is those who are infected but asymptomatic. That is, you have a COVID infection, but you have no symptoms. Those patients, according to CDC, the chance of spreading is 13%. And that may not be the right figure, and I'll just tell you why. In the end of January, New England Journal of Medicine published a letter from the Germans saying that a Shanghai businesswoman who visited Germany, she was asymptomatic, and she caused 4 Germans who talked with her, spoke to her, had business deals to give them COVID.
Right.
Now, this is dangerous. She was completely asymptomatic and she's spreading like hell. So this got all the epidemiologists, all the infectious disease doctors really scared. In fact, Tony Fauci himself commented that this is really dangerous. But now we know this story is fraud. It's a lie. Why? Because people who wrote the actual article in New England Journal of Medicine did not care to call this lady and find out that she was symptomatic.
Right.
The Robert Koch Institute, which is part of the German government health ministry's institute, they wrote to New England Journal of Medicine, according to press report, that she was actually symptomatic when she was supposed to have spread COVID.
Right.
So it's a completely different ball game. One is asymptomatic, pre-symptomatic, Tom, Dick, and Harry, Ram, Sham, you shut everybody down. The whole country is closed.
Right.
The other is you are symptomatic. I test you, you're COVID positive. You have to stay locked down. Everybody else can go to work. Those who are asymptomatic, those who have antibody, those who have been tested negative, even if they have symptoms, because Remember, the symptoms can be common to allergy, common to cold. There are millions of other cold
Right.
viruses. So symptoms doesn't COVID doesn't come with super peculiar symptom other than one or two, like anosmia, which is loss of smell. In kids, it comes with something called multi-inflammatory disease. But those are exceptions. But bulk of number one, 80% of the people are asymptomatic. They don't even go to hospital. They're either asymptomatic or mildly symptomatic. Only a few need to go to the hospital. Now, if we know that the bulk of these guys who are asymptomatic, only 13% of them are spreading, 87% are not, that
Right.
means the bulk of the population can go to work. You can open up your small businesses, which employs a lot of people. You can open up the retail shops, which employs a bunch of people. You can open up the offices where people can maintain social distance and work on their desks. So it's a completely different thought process, a paradigm different from what we thought before about COVID and COVID spread.
Right, Dr. Basure, it completely forces us to radically rethink how we should be going forward in our battle against COVID 19. Because what you're essentially saying is that we have to identify these very, very small sort of hotspot regions and shut them down while the rest of the country can actually go about its work. Secondly, what I also infer, and you can correct me on this, is that this there is this claim always that we should be mass testing in very, very large numbers. Would that become a bit redundant with this new scientific knowledge?
So, yeah, so no, mass testing will not be redundant. The reason is very clear. As you're opening up, more you test, the better. If somebody has no symptoms, somebody doesn't have COVID, there is no reason to keep him locked down at home. He can go to
Right,
work. So, mass testing should be done for pre-symptomatic or asymptomatic people. Even for symptomatic people, it should be done because by that you will know who's symptomatic and who's not symptomatic. Sorry, who's infected, who's not infected. If you may be symptomatic because of your allergy, there's no reason to keep you at home for 14 days. You have to add to the economy. You have to bring the country back into its feet so that the economy starts running.
right,
So that's important that mass testing should be done and aggressively pursued. But it should be targeted so that it brings out the appropriate results.
right,
The second point is yes, now we need to form definite criteria for opening up. As you correctly said, while the country needs to open up, it needs to open up in phases. Places which has not had that many deaths, that many infections. For example, take your state, Karnataka. Karnataka has not had that many deaths compared to
yes,
say Gujarat or compared to say Bengal. I don't think Karnataka, I don't have the population statistics, but I don't think Karnataka or Bangalore is way less populated than, say, Calcutta, or maybe it is slightly less, or for that, but I don't think it's much less than, say, Ahmedabad.
right,
But for whatever reason, and honestly, we don't need a reason because this thing is called super infecting attitude of the virus that it a small people are super infectors. They infect a lot of people. We don't know the science behind it. So
right,
why Karnataka has less infection and Gujarat has more? If for granted that both of them have maintained equal social distancing, we don't know. But having said that, without knowing the science also, we can still think that let's start opening up Karnataka first or take those states with the lowest numbers and start opening them first. Of course, by doing appropriate testing to make sure that those who are not infected, they can start going to work. While those
right,
who are symptomatic and infected, they need to stay locked down and in their homes. They cannot step out. Or those family needs to be their contacts need to be found out, and those family needs to still stay in lockdown because their chance of giving infection to their family is high. But the bulk majority, which I don't know how much percentage it could be, 60%, 70%, 80% of the population can slowly go to work. Now,
right,
the opposite needs to be done in hot areas. In hot areas, those population need to be restricted. Strict social distancing needs to be maintained. Strict social distancing need to be maintained. Strict contact tracing needs to be done to eradicate the fire. Because
Right.
if you don't do that, then the fire will spread. So what do you do for those areas? Those areas you have to have a norm. The norm, for example, could be, my suggestion would be something like that. You have you maintain all these three things. That is super social distancing. Everybody follows social distancing. They stay home from work. You do appropriate contact tracing, and you do mass testing, especially in the hot areas. And based on that, you see how it progresses in the next 2 to 3 weeks. Maybe you can keep a moratorium of 2 weeks in these hot places.
Right.
Bombay, Calcutta, areas in Gujarat, and then see how they do. Those which show a trend of coming down or straightening or the curve going down, they can then slowly start opening. If not, right, then you can further distance it till you either develop herd immunity, or there comes a vaccine, or one of the new drugs that have been started to said to be working, like remdesivir or a plasma transfusion is available. And the people who are intermediate between these two, that means they are not hotspots, they are sort of orange, they are not as green as other states. There, you do is watch and see if you see that in the next 10 to 14 days their curve is coming down, start opening them up. That I
Right.
think would be the policy, because remember, India is a huge country, just like America. India has 3 times the population of even America. So what, and America is trying to open up. Yes, when you open up, there may be increase in number, and that's where scientific prudence is important. But at the same time, with scientific prudence, you cannot ignore ground realities at the same time also. It has to be a combination of both, and that's very important.
Right. Dr. Basure, just finally, I think this is a question that's been on the minds of a lot of people in India. We are seeing a huge variation in, say, case numbers and fatality rates across states. So you're seeing a couple of states having similar cases, but the fatality rate varies widely. What is the explanation for that?
It's difficult to say, because I'm not sure if there's a different strain, which I don't believe it is, because I think there are, we do not, as I just said, there are super spreaders. Why some people are super spreading, why some are not, we don't know. Number two is, every state, the level of social distancing is different. We know some state which has thrown the entire concept of social distancing to the wind, whereas there are other states which are very strict and following it strictly. Number three, in a country like India, education is very, very important to make people understand. And that differs also from city to city, state to state. Um, so that you come, for example, Kerala has shown excellent results, but so we need to find out what, so all these factors can play a role in order. Now, having said that, if every place maintains, and the same is the story with America also, there are states which maintain strict lockdown, they have less numbers. And I'll give you an example which actually proves that lockdown that India did pretty early actually was more helpful, because we just had a modeling come out from Columbia University, which has done a lot of modeling in this pandemic. So based on May 3rd, America had 65,000 deaths. And that was based on the fact that America started lockdown and social distancing on 1st of March. Right. Based on the modeling, if America did their lockdown and social distancing just a week before 1st of March, the number on May 3rd would have been 29 to 30,000 only. Wow. And if the lockdown was done 2 weeks before 1st March, that is around middle of February, the number of death on 3rd of May would have been only 11,000. So you could save 50,000 deaths by preceding your lockdown by 2 weeks.
Right.
So India, Mr. Narendra Modi's government, I think, played an extremely good role by clamping down the country. But now, when, as you correctly said, we are in lockdown 4 and slowly the country needs to be opened, I think while India has done an extremely good job, there has been some increase in number in different states for different reasons. But with the scientific prudence, if we slowly start opening, I don't think there's any other way.
Great. Thank you so much for your wonderful insights, Dr. Basuri.
Thank you for having me. Take care.